chat box after we keep this live in YouTube. So if we have students join there, we can start. Can we start?
Yeah, I will just wait for a minute or so. It's not yet 12, right? We asked people to they join around 12
Sure,
or after that.
sure.
So everyone, the YouTube link is there in your chat. If you want to share it with your friends, neighbors, you can go ahead and do that. And we would be starting in just few seconds now.
Chaitanya, students are requesting to send the link again. Can you repaste it in the chat box?
Yes, Pavni, start, please.
Yeah. A very good afternoon to everyone. So this is a session for the students which are in 6th to 8th class, and this is regarding the dengue and the dengue fevers and the mosquito which transmits the dengue fever. So here is the agenda for the session. A welcome note by me. I'm Dr. Pavni. And before going to the agenda, I would like to ask Ms. Poonam, who is there as a panelist, will you please introduce our team so that it will be easy for your students to get to know about us? Ms. Poonam?
Yes, ma'am.
Thank you.
Namaste to all the students, teachers, and the panelists for the day. I welcome all to a session on School Public Health Program launched by Indian Institute of Public Health. The objective of this webinar is to orient the schools in Hyderabad to a novel initiative, Project No Fever, launched by Indian Institute of Public Health, and introduce them to the school awareness program and various activities under the project, which the schools can engage with the students for keeping the school and students safe from fever. Let me introduce you to the panelists of the day today. We have Dr. GVS Murthy, who is the Vice President, South Public Health Foundation of India and Director, Indian Institute of Public Health, Hyderabad. He has more than 40 years of experience in public health and is part of top 2% scientists in the world featured in the recently published Stanford University list. Our next panelist is Dr. Rajan Shukla, who is an additional professor at Indian Institute of Public Health, Hyderabad, with more than 20 years of experience in the field of public health, academics, and healthcare sector. He specializes in surveillance, quality of healthcare, and health systems strengthening. Thank you for being with us, sir. Next, we have Dr. Samiksha Singh. She is an additional professor at Indian Institute of Public Health, Hyderabad, with more than 12 years of experience in the field of public health, academics, and healthcare sector. She specializes in maternal and child health and health systems research. Next, we have with us Dr. Pooja, who is a consultant at Indian Institute of Public Health, Hyderabad, with nearly 9 years of experience as a public health professional. Last, we have Dr. Pavani, who is a senior program assistant at Indian Institute of Public Health, Hyderabad, with nearly 5 years of experience of working in various public health projects. Without any further delay, I would like to hand over the session to you, Pooja.
Thank you, Ms. Poonam. It was a great introduction about us. And I would like to share the agenda for the session. So, um, there was a so we are going to show few videos where from which you can get to know about the dengue and why dengue as a disease should be taken seriously. In that, we are going to show what are the symptoms, what are the measures that you can take, outdoor measures and the indoor measures to prevent the dengue mosquito, and about the mosquito, what is dengue mosquito and how we can fight. There was a story by Sonia also, and we will show this through the videos. And at the end of the video, we will have an activity, and after that we will give instructions for the quiz, which is an intra-school competition. I will explain you about that, and we will end the session with a question and answer session. Please, students, you can post your queries in the chat box, or sorry, you can post your queries in the question and answer session, and we can answer you. Okay. So the chat box we will use for getting the answers for the activity. So you can post your queries in the question and answer section. Thank you. So what you are going to gain from this session, you can recognize the symptoms of the dengue fever and its modes of transmission, how you can keep yourself protected, like personal protection from the mosquito bites, and what are the measures to prevent mosquito breeding, and effective ways to prevent spread of dengue fever. And this session will also helps you to realize the importance of the community participation, and along with that, how you can keep your environment like neat and tidy with maintaining the environmental hygiene, and how you are responsible to maintain the environmental hygiene. And it will also improve your communication skills, and along with that, the responsibility towards the premises in your schools as well as in your livelihood by ensuring the mosquito-free environment. So without any delay, I would like to play this video, which will let you know about the dengue and why dengue as a disease should be taken seriously.
My name is Dengueris. Yes, I admit to spreading the dengue virus that has killed hundreds of people across the world. And I confess that I will not stop. You may have caught me, but my sisters are out there doing the good work. Why only my sisters, you ask? Because our brothers are useless. They make all of the women do all the hard work. I am from the clan of Aedes aegypti. There are other mosquito gangs out there, but we are the most dangerous. We are the only ones that carry the dengue virus. All our gang members are recognizable. We all have unique white marks on our legs, like this. My home is in dirty water. We love rainy weather. And all our secret base camps and training camps are in stagnant water. Whenever rainwater collects in puddles, in discarded tires, or in open toilets, we are probably there, loading up on dengue virus. It is monsoon season, and we are stronger than ever. We are coming for you. Beware.
Severe headache, pain behind the eyes, nausea and vomiting, high fever with 2 or more of the following symptoms, severe muscle and joint pain, a rash on the skin. Consult a doctor and do as advised. If advised hospital admission, do so immediately. If advised home-based care, take plenty of fluids, nutritious food and paracetamol for fever and pain. Prevent mosquito breeding and protect against mosquito bites. There is no treatment for dengue, but dengue can be prevented.
In COVID times, it is important to understand fevers and how we should go ahead with dealing with these fevers. So just summarizing that dengue symptoms, as you saw, high fever, muscle or body aches, pain behind eyes, rash on skin, tiredness, dry cough. So the top 4 are very important, and these are seen in mild cases. Once the fever breaks, unfortunately, it's very peculiar to dengue. Once the fever comes down, it's when the most severe symptoms of dengue start to appear. And the later ones, if you go down in the list, are the ones which are for the severe disease. Low blood platelets count, bleeding manifestations, bleeding gums, bleeding nose, bleeding from any other sites, and it doesn't stop. Those are all signs of severe disease. And ultimately shock. Shock is when, you already saw in the video, the blood cannot easily circulate in your system. But if you see on the other side, the COVID-19 symptoms you are all aware of, you are well read, and you're aware of these things which are going ahead. Everybody is taking precautions of COVID-19. But if I just list you the symptoms of COVID-19 again, although it is fever, dry cough, tiredness and fatigue is more in COVID-19, loss of taste or smell, sore throat, nasal congestion. But you see, for the rarer symptoms of COVID-19, which can appear, and these ones, sore throat, nasal congestion, rash on skin, body aches, these all can also look similar to that of dengue. So in COVID-19 pandemic season, if you get any fever with some kind of body ache, rash, it is very difficult to say if it is dengue and COVID-19. Both of them are dangerous at this time, and dengue more so in children. So we have to be very careful and be aware and tested for the disease, what it may be. And unfortunately, because of this, they can lead to delay in appropriate treatment, and that can lead to complications and a severe disease. Right? What are those dangerous symptoms? As per WHO, for dengue, abdominal pain and tenderness. If you have extreme pain in your abdomen, be careful. You are vomiting, you are very weak, very restless, then it is a danger sign. You have bleeding gums, bleeding nose, any part of the mucosa is bleeding. And if doctor examines on X-ray, there is water in lungs or abdomen, you definitely need emergency hospitalization. For COVID-19, if you have difficulty in breathing, there is persistent pain or pressure in the chest because your lungs are involved. See, both in dengue and COVID-19, lungs are involved. But in COVID-19, if you feel a lot of pressure in the chest, there's a new kind of confusion that comes in which was not earlier, and you can't think properly. That is also a danger sign. You find it very difficult to wake up, you feel sleepy all the time, and a later stage when your oxygen levels go very down, you will see your lips and face getting blue. These are the danger signs when you immediately have to get checked and get admitted in the hospital.
Now we know what Aedes is, we know where it breeds. So what shall we do about it? So first thing is, don't let them breed. That's the best way of controlling their spread, their generation, their numbers. As I told you, they lay their eggs in water collections, and in that water collection, they grow into larvae, and the larvae then grow into an adult mosquito. So what can you do? Firstly, just keep all the water storage that you have closed all the times, right? Be it in your bathroom, be it your overhead tanks, be it sumps, wherever you collect water, it should always be covered. And the other sources where the water is collected, as you can see in the pictures, that please drain them once in a week from your flower vases, from your buckets, even the trays under your pots. This is rainy season. If you have gardens, you will also see that the soil of the pot often gets tough and the water forms a layer on it after heavy rains. Even that much of water can harbor mosquitoes and eggs. So it is important that timely ensure that you loosen the soil of the pot that you have so that the water goes in and there is no water collection for larvae to stay or live there. Even places like gutters or rooftop gutters or certain pipelines, you will see some open pipes at the top of your roof or something, even horizontal pipes, as you see in the last picture. A little bit of water there is enough to lay eggs. So you should keep them covered. In case there are water bodies that you cannot drain or clean, in that case, we have another options which you can apply some oil Temifor to that water so that the larva is killed. But they have to be used in certain concentration only under guidance of the adults. For larger pool of water collection, there are also fishes which can be used to, these fishes eat the larvae, and so they don't let them grow in from larvae to adult. So these are broad practices which we need to do to don't let the mosquitoes breed. And if they breed, kill the larvae. These are called larvicidal activities. Now, I told you that it takes 7 days from a egg was to develop into a mosquito. So it is very important that we repeat these activities every 7th day. In Hyderabad, you must have heard about a campaign which was started with GHMC, and it was every Sunday, 10 minutes for 10 weeks, especially during this season. The rainy season and the post-rainy season is the main season when the mosquitoes breed. They in fact breed with much more intensity and much more in numbers compared to other seasons. One more point I want to make here is that the water collection is sometimes also because of the waste we throw. All the household waste or any other waste should be first collected in closed bags and then handed over to the municipal corporation or thrown in the bins where it goes. So that's the responsibility which starts from at the home itself. Next thing what we can do is, if one is we stop them from breeding, another thing is we don't let them bite us. And as they are day mosquitoes, so you have to protect yourself. Try to wear full covered garments, full sleeves shirts, full pants. And if you're going out, you can apply certain ointments which are really easily available in the market. Your parents would know them. Or there are also certain sprays. The sprays you can have a spray on your skin, exposed skin. So the mosquitoes, even if they come close to you, they will go back. There are also some kind of ointments and sprays and rollers which you can apply towards the end of your sleeves. So even that much would push the mosquitoes away. Because it is a day biting, I'm repeating it, while you go to school, while you go to play, while you go to any neighbors, even whenever you step out, you have to ensure, especially in this season, that you are protected from any mosquito bite. At home, if you notice mosquitoes, you can do sprays, you can use vaporizers, you can use mosquito coils. Again, advising it that you should use them also during the day. If you're sleeping during the day, young children, very young children, right? And they should always sleep in the net either during day or night. In night to protect from malaria. Keep your doors and windows closed. If you want to keep them open, you can use window meshes. And there are window meshes which if you spray insecticide on them, or they're called insecticide treated window meshes or window curtains or door curtains, they are even more useful. One, the meshes will not allow the mosquitoes to come in. And if they're treated with the insecticide, if the mosquito tries to come in and sits on the mesh, it will get killed. So you are doing the two things together. You're not letting them in, you are as well as killing the mosquito who are trying to enter your home. You must have seen outdoor spraying happening, and that is to kill the mosquitoes, both Anopheles and Aedes. There are other techniques also of killing the mosquito, where we use mosquito traps and sugar baits. These are interesting things where the mosquito will come and get killed while trying to eat the toxic sugar. So these are the activities, some of which you should do. We would suggest that at least start from protecting yourself and your family. till your home. You can ask your parents to take up the outside activities. You can ask your RWAs to take up those outside activities. Note here that the children and the pregnant women are most susceptible to dengue and they get the more severe disease. So if you have any small children in your family, any pregnant woman, please take these measures more frequently and more meticulously.
Don't underestimate me. I may be a vector mosquito.
The best preventive measures against mosquito-borne diseases are to eliminate pockets of stagnant water that serve as breeding sites for mosquitoes and to avoid mosquito bites. It is not difficult to prevent mosquito proliferation. Change the water in vases once a week and avoid using saucers underneath flower pots. Ensure air conditioner drip trays are free of stagnant water. Cover water containers tightly. Put all used cans and bottles into lidded dustbins.
Cover the dustbins properly. How to prevent mosquito bites.
Wear loose, light-colored, long-sleeve tops and trousers and use DEET-containing insect repellent on exposed parts of the body and clothing. Reapply insect repellents according to instructions. Avoid using fragrant cosmetics or skincare products. Pregnant women and children of 6 months or older can also use DEET-containing insect repellent. Third, if you need to go to endemic rural areas, carry a portable bed net and apply permethrin, an insecticide, on it.
Never apply permethrin to skin.
Fourth, seek medical advice promptly if feeling unwell. For example, running a fever after returning from affected areas, and provide travel details to doctor.
I adopt all safety measures when cycling, and of course for traveling too. Remember these 4 tips to be surefire.
So hope everyone had seen the videos and learned few things. So this is our activity. So the first question in the activity, we are going to ask you these questions and the answers you can type in the chat box and we will let you know at the end the correct answer for these questions. So look at the figure. I'll just read the question for you. How frequently should you be cleaning these to not let the Aedes breed? So the hint here is anything that can hold water for few days can breed mosquitoes. So the options for you, every week or every month. You can write your answers in the chat box and let us know. Hope everyone was typing their answers.
Yes, they are. Yes, they are, Pawnee. We have lot of answers.
Yeah. So may I know the answer?
It's every week from almost everyone. I cannot read their names because they are typing at so fast.
Okay. Thank you, Pooja. It's every week. The correct answer is every week. So we'll go to the next questions. So here is the next question for you. So look at the figure. How many mosquito breeding containers or sites do you see? The hint here is anything that can hold water for few days can breed mosquitoes. So you can choose from option A and option B. 5 to 10, option A, and option B is 11 to 15 sites you can see. How many? You can type your answers in the chat box. and let us know.
Hold on, guys. Count properly.
In fact, I would suggest you list down the sites which you are seeing.
Yeah.
Then you will know the count.
Yes. Don't type randomly. Count properly.
So hope
Yes. So
we will get the correct answer.
no, they will come to the correct answer. Now they
Okay.
have started counting properly, so they are coming to the correct answer. Very good, guys.
Yeah. So I can also tell you there is the tap here, the water which is near the tap, the tire which is hanging to this tree on the water, the stagnant water here, and the puddle, the bird bath, the pool, everything, the dustbin which is not open, which is not closed, and a plate, the flower plate, the plate which is placed under the flower pot, everything,
Yeah, the
and the
barbecue,
bottles.
the
Yeah.
barbecue which can collect the water.
Yeah, and the bottle and the glass which is open, which is kept open, and the roof, the gutter, the roof gutter, where the water will connect, the rainwater will collect. These are all. So, what is the answer? The correct answer from you guys itself?
Pawnee, there are mixed answers, but most of them have typed 11 to 15 now.
So initially everybody almost answered A, but then halfway through when they were able to go through the picture properly, I think after that most of them, almost 90% of them have answered B,
Yeah. Yeah.
which is 11 to 15 locations, which Pawnee already said which are those. Excellent, guys.
Yeah. So we'll go to the next question. So this is a quick revision about the facts about dengue. So because Aedes mosquito, it sucks our blood, so that we mentioned it as a criminal. Aedes spreads dengue, chikungunya, and Zika. So what they do, they suck your blood. They're attracted to the sweet smell. And if you guys are playing evenings, you will play in the playgrounds. So if you are playing and you are not cleaning, like you are not taking the shower, and if you are sweating, so for that also this Aedes mosquitoes will be attracted. The sweat also attracts Aedes. They bite during day, morning, and the evening. They live inside your homes, and they can fly up to 200 meters, 200 to 500 meters. They can fly. So most probably they will be surrounding you only in your residences, in your school areas. So they will be there, and they attract to the sweet smell. So they like dark areas and the corners in your school, in your school premises, in your residences. Also the corners or the curtains with the curtains which are placed in the dark areas. These are the resting sites for them. Female mosquitoes spreads infection when it bites. Once infected itself, it can infect humans all its life. So if the female mosquito is biting the infected person, the lifelong the mosquito will spread the dengue to others who it bites. Other thing, it lays eggs in artificial stagnant water collection, as you already saw in our previous question. And the more blood they suck, the more eggs they lay. So in 7 days, eggs grow into an adult and they are ready to bite. So we have to break this 7-day life cycle. We have to remove the stagnant water. We have to keep our vases, flower vases, which are filled with water, and flower pot plates clean. We can clean the water. You can clean the water within 2 days. Frequently, you can clean within 1 week. Don't just keep the stagnant water more than 7 days. So in India, it is Aedes aegypti is a more common vector, and Aedes albopictus is also there in India. So before going to give the instructions about intra-school competition, uh, we are planning this competition, intra-school competition for the schools, or for the children of 6 to 8 class school, 8 class students, sorry. And after this intra-school competition, is within the school, and the teacher coordinators will help us in completing this intra-school competition. So for you guys, we have
Before we go on to the inter-school competition, shall we take up some questions? Because I guess there has been rush of information.
Sure.
So let's give them a breather. And if they may have any questions, they can write in the question answer box, or they can raise hands and we can ask them to ask
Dr.
questions.
Samesh.
There are already questions there are already questions in the question and answer box, so we can take that first.
Okay, great. So there are a few which I have already answered simultaneously, but for the benefit of others, I can reply to those questions here. So a few of you mentioned that they have had dengue once and or twice, and somebody also asked, do we get T cell memory after dengue infection? Things basically relevant to reinfection of dengue. So here I want to tell you that dengue virus has 4 serotypes. So if you get infection with one serotype, then you may not get infection again from that type of dengue virus, but you can get infection from other 3. So you do not get cross immunity. You get immunity for the same serotype, but not for the other 3. So to understand, you can get dengue at least 4 times in your life. But what is important to notice here is that usually the first infection is milder, but the second time infection, third time infection, and fourth time dengue infection is more severe. So if you think you have had dengue once and you will not have dengue infection again in life, that is wrong. In fact, if you have had dengue once, you should protect yourself even more, and your family members also even more, right? So that's the question about reinfection. Yes, after dengue virus infection, you do get develop memory in T cells. You do also develop immunoglobulins. That is a normal reaction for any infection. But as I said, that will be only for the serotype which has infected you. Okay. Now, there was other question which I've answered is there any cure for dengue? There is no specific cure for dengue. Only thing we try to give is to cure or to support the symptoms, right? So mostly dengue is self-limiting. It cures by itself. But you have to take care of few things, even if you have fever, mild cases maybe. You take medicine to reduce fever. Paracetamol is the safest drug to take. So everyone, children are now well aware, alert citizens growing into adults soon. Paracetamol is the only safest fever drug which you should take. This is the safest even for COVID infection and dengue infection, unless your doctor does all the investigations and gives you other drug. But if you are taking any medication by yourself or your family, your parents give you any medication before reaching out to the doctor, please ensure you just take paracetamol or called Crocin to reduce your fever. Drink plenty of water, eat well, sleep well, right? So this is what you have to do. We do not have any specific treatment, but if you just take care of some such things, most of you will recover. But there are few other things you should know. When do you think the dengue is worsening? When do you need to go to a doctor, revisit the doctor? And carefully listen. So if you have vomiting, if you have pain in abdomen, severe pain in abdomen, right? In dengue, you anyways have body ache. But if you have localized pain in abdomen, if you have red patches on your skin, if there is any bleeding from anywhere, if you have any of these symptoms, then you need to immediately consult a doctor. And then as per the symptoms, as I said, there is no treatment. As per the symptoms, doctor may give you IV fluids or may give you blood transfusion, keep you under monitoring, and most of you will recover. That's not something to worry, but the important part is that you should watch what is happening. And you are young kids. Another interesting fact I'll tell you. Severe disease in dengue usually occurs once the fever starts to come down. In other diseases, what we think, the fever is coming down, then I will not have severe disease. However, in dengue, when the fever is coming down, there are chances that you may have abdomen pain, you may start vomiting, you may see rashes on your skin. So don't ignore them, right? So you have to go and visit the doctor. So I hope I've answered the questions around what happens in dengue, cross immunity, or about the treatment part. Right?
There are a lot of questions about the transmission of dengue. I think, sir, you can take these questions.
Yeah, so let me just start with the first one, which is more dangerous, dengue or malaria? I think both are dangerous. The good thing about malaria is we know the treatment for malaria. So if somebody gets malaria, we know how to treat and we can cure that person and stop the progression of the disease. In dengue, unfortunately, there is no treatment available at the moment. So we can only provide supportive treatment. The reason why dengue has suddenly become among the top 10 conditions which WHO also focuses on is it is spreading very fast across the globe. Today, we believe that almost 50% of Earth's population is at risk of getting dengue. So we are all in that area where Aedes mosquito and dengue virus both are playing tango. The second question is very interesting question. If an infected mosquito lays egg, will the baby mosquito be also be infected? And this has been asked by Nikhil. Nikhil, till the recent past, we only thought that it is when a mosquito bites a person infected with dengue, then the mosquito gets the virus. But recent studies have shown that there are occasions when dengue actually the virus actually gets passed from the mother mosquitoes to the egg and to the offspring. So the baby mosquitoes might also be carrying dengue, though it is not very rampant, but it can happen. So there are studies which are demonstrating, and that's how they say it keeps the dengue season alive, even in those areas where you have a very severe winter uh, in place, and the breeding of mosquito stops during the winter, as we all know. Okay. Any other question, Pujal?
Yeah, so there are like questions like other than paracetamol, can we use crocin or Dolo 650 tablets?
Yes, so paracetamol is the generic name of the drug. Crocin is also paracetamol. Dolo 650 is a 650 milligram tablet of paracetamol. But for children, don't use Dolo 650 because that becomes a higher dose for you. Okay, it is for adults.
Then the question is, in which season dengue is most severe?
I think I answered part of that, when it becomes cold, when it really becomes cold, especially in North India and all, where the temperature go below 5 degrees Celsius and some places even sub-zero, the mosquito breeding stops. So when does mosquito breeding happen at its most active phase? That's during the monsoon season. And that's why it's the monsoon season, and immediately after the monsoon season that the dengue virus, dengue infection prevalence and infection peaks in the community.
The next question is by Dipansha. What if a male mosquito bites an infected person?
Yeah, so Dipansha, I think it was mentioned somewhere in the video and you missed it. Males don't bite. Males survive on fruit juice, nectar. They do not need blood, and blood is not their natural food. It is only the females who bite because they need blood, the proteins and the iron from the blood for the eggs to mature. So if they bite us, they lay more egg. That's why it is important that we don't allow them to bite us and allow them to lay more eggs and make a nuisance and a threat around us.
So the next question is from Nazneen. It is a virus alive?
Virus, yes. So I think that this question will be answered more appropriately by your science teacher, but virus is something which is a genetic material which cannot reproduce on itself. So it doesn't fall in that category of living beings exactly, but it uses a host cell to multiply and reproduce itself. Okay, so that there is a controversy, but yes, we in the health, we take it as something which is alive, which can reproduce, but it cannot reproduce by itself. It uses the host cell to reproduce. All the systems in the host cell are used.
Okay, I'll take this next question from Anantara. It is, if a pregnant woman has dengue or malaria, will the baby also have dengue or malaria?
Chances are less, but there have been some incidents where there has been placental infection, but otherwise the chance of baby having is very, 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 very low.
Okay. Another question is, how do we differentiate between a male and female mosquito?
That's a difficult question, but for your simplicity, you will not find male mosquito flying around you. They are not interested in you. They are not attracted by your smell. They are not attracted by carbon dioxide because they don't want to feed on blood. So if you find a mosquito which is flying around you and is waiting to bite you or is bothering you, then most likely it is a female mosquito.
How many days does a mosquito live? Is what Ishan is asking this.
Yeah, so Ishan, there are two parts. One, you remember the video said, and Dr. Samiksha said, any collection which happens every 7th day, clean the water, because the life cycle of mosquito is around 10 to 12 days. So if we are cleaning the water every 7th day, the breeding cycle of mosquito is around 10 to 12 days. So if we are cleaning the water every 7 day, we are not allowing that breeding cycle to become complete. That is, it lays egg and then forms larvae, and then the larvae goes into pupa stage, and from pupa the mosquito comes out. It's the same as butterflies where metamorphosis happen. An adult mosquito, the female mosquito can live for 4 to 6 weeks. A male mosquito usually lives for around 2 to 3 weeks. It doesn't have a very long life. Yeah.
So, does dengue spread in winter? I think, sir, you have answered most of these questions. They are more or less similar. What treatment should we take when we get malaria? So there's
don't take treatment on your own when you get malaria first. Let the doctor decide the treatment. But artemisinin and sulfur dioxide is, if you have falciparum, that's the treatment for falciparum, and for Vivax, again you add primaquine doses to that. But don't, on your own, you are not supposed to take any treatment, except if you have fever, you can take paracetamol, or if you have some vomiting or something, you can take medicines. If you have allergies, you can take something like cetirizine, but don't go beyond that. Consult a doctor.
Okay, so someone is asking, can we get infected by both dengue and malaria together?
You can. I mean, if you look at the probability, that probability is there, but the transmission is not by the same mosquito. So dengue is spread by Aedes mosquito, and malaria is spread by Anopheles. So That's why you will not get the likelihood that both the infection happen together is very, very low, but possibility is there.
Yeah. So, sir, I think we have answered most of their questions. And right now, I think we can hand it over to Pawnee to just give them the instructions about intra-school competition. Don't worry, keep on typing your questions. We will try to answer them. Pawnee, over to you.
I think Trisha's question I have already answered. Why do female take blood, not male? Female need blood and the iron and protein from blood for eggs to mature. Males don't lay eggs, so they don't need it.
Right. There are few questions repeatedly coming that can it transfer from human to human, dengue?
No.
No, it yeah. So it cannot. It only transfers via the mosquito. So mosquito, when it bites you, when it is sucking your blood, it will take virus inside. Then the virus goes and lives inside the mosquito body till the mosquito lives. Once a mosquito infected, after that, whichever person the mosquito will bite, it will spread the virus for life. So one infected mosquito can spread infection up to hundreds of people. Other important thing to know about these mosquitoes are that a mosquito in its life, female mosquito can lay up to 400 to 1000 eggs. So if you do not stop mosquitoes from breeding today, with every season, the number of mosquitoes, they are increasing in your community, in your area. So every mosquito has to be stopped. Every female mosquito has to stop, because if she manages to lay egg, she can lay eggs up to 400 to 1000 in its life. So that's the seriousness of this activity and information which we are giving you. And because dengue is spread through Aedes mosquito, which lives close to your home, in your school premises, in your residential premises, only the residents can do most of these efforts for not letting water collect, not let mosquitoes breed. Governments cannot come into your home and check every day or once in a week, or come to your residential colony once in a week and do. As you are taking responsibility of keeping yourself safe in COVID times, similarly, you have to take responsibility of keeping yourself safe from dengue for at least next 10 years or 15 years to come, till we have big interventions at state level to reduce mosquito population. So it is your own responsibility to protect yourself. Okay, just wanted to add. Yeah, Pavni, over to you.
So thank you, everyone. So without any delay, I would like to give instructions about the intra-school competition, which is the quiz for you students. And this quiz will be open within 2 days, after 2 days. So I'll give the instructions. So the 3 members who are who scored well and who finished this quiz within a required time, specified time, so they can be transferred to the inter-school competition, which will be held with the other schools. So from those schools also will have 3 members, and they we will plan for an inter-school competition. So for this instructions for the intra-school competition, let me go to the another slide. I think, yeah. So the theme for this intra-school competition is dengue and COVID-19. And then sub-themes under this is dengue epidemiology, the symptoms, prevention, and control. The COVID-19 epidemiology, symptoms, prevention, and control. These are the sub-themes. And don't worry, students, we will share the material which you have to read. So, and we are going to give you 2 days time to go through those materials, and you can answer the quiz. So the quiz is online quiz. It will be around 10 minutes, and you have to attempt 20 questions. This is on Thursday, that is 10th December 2020, and the quiz slot will be open online and accessible to you through link from 4 p.m. to 4:30 p.m. So we hope that you will finish with your schoolwork and then you can attempt this quiz. So the link will be shared with your school coordinators and they will further share it with you on your email IDs. And the quiz will be made available in given time slot, and fastest 3, as I mentioned, the fastest 3 highest score will be the winners. So you just go through the material which we are going to share and you can attempt the quiz and you can be the winner. And the results will be displayed within a week's time and the winners will be taken ahead for the inter-school competition, as I mentioned earlier. So we are not having any negative marking for the quiz. So we think that you people will actively participate in the quiz and take the quiz and be as the winners. So this is all for the instructions for intra-school competition. And if you have any queries regarding the quiz or anything, you can also write to our email ID projectnofever@iiphh.org. So you can find that email ID in the chat box also. I'm repeating the email ID projectnofever@iiphh.org. You can write your queries and you can also coordinate with your school teachers and they can be as like they can also give the queries from you, and the school coordinators will share the link with the quiz link with you, students. So thank you. So any questions, you can raise your hands. We are here to take your questions.
While we are waiting for them to
Anand,
raise their
Anand,
yeah.
Deepansh and Anand. Either you can type your query or you can unmute yourself.
Anantara, you can talk now. Can you hear me? Yeah.
Can you hear me?
Yeah.
Ma'am, is there a particular blood group which gets bitten more?
Yes, there is a particular blood group, but there are few studies which do suggest this. So type O blood group gets bitten more. Type A gets bitten the least, and type B is somewhere in between.
Thank you, sir.
Anyone else?
While we have somebody else, there is one question from somebody anonymous. Why is it that more times you get dengue, the more severe it gets? And the reason is the first infection of the dengue actually uses your white blood cells to grow, to breed in your body, to spread in your body. Okay. So the first infection actually primes your white blood cells, and the second infection finds it easier to infect the white blood cells. And that's why white blood cells and the whole chain, including the platelets, the mother cells of platelets, etc. So that is why the second infection is and subsequent infections are more dangerous than the first one. The immunity to the first infection doesn't prevent you from getting the second infection, because that's a different serotype. Okay. Yeah, Pavni, somebody had raised a hand.
Yeah, Deepansh, I think, and Kritika Reddy also raised her hand.
Deepanshi is, I can't find her. Kirti Reddy, right?
Yeah, Kirti Reddy.
Kritika Reddy.
Kritika, sorry, Kritika.
Yeah, so you can talk now. Kirtika, are you there?
Yeah, ma'am.
Yeah,
ma'am, can you hear me?
Yeah, we can hear you.
Yeah, is that the person was infected when he's strong, then you can cure faster? When the person is strong, The
Okay,
dengue can
so
cure
when person is, I wouldn't say it has anything to do with strength. It does have something to do with health. So if you are healthier, usually any infection, your general immunity helps you to ward off the infection. Even if you get infected, you recover much faster because healthy body has a better immune response. But the dengue virus is a devious virus. And as I said, usually when you get infection with one virus once, you have lifelong immunity. But here you have 4 strains and subsequent infection. Actually, your own body's systems, the defense mechanisms are used by the virus to attack you. So subsequent infection, um, your strength, body strength may not be very helpful. What will happen is if you have good hemoglobin levels, you can, to some extent, if you are very healthy, you don't have any chronic renal disease or any of those things, then you might be able to cope with the infection much better. But it doesn't really help in terms of recovery.
May I ask one more question if possible?
Yeah, please.
Sure.
Yes, sir. What if corona infection and dengue attacks to the person at one time?
That's a very interesting question. And
Rajan, there is a similar question asked here, so I thought you can answer both of them together. So it is key. What are the similarities between COVID and dengue fever?
Okay, so first let's come to what are the similarities and dissimilarities. Usually to distinguish dengue and COVID is not very easy. So don't just based on symptom make an attempt to it. But there are some few nuances which can be seen by experts, but even they then rely on diagnostics to distinguish. So they don't do it clinically. The similarities are both have fever, both present with fatigue, some amount of body ache. Um, Cough is more common in COVID-19, especially dry cough, but it is not that it doesn't happen in dengue. It can happen, but to a lesser extent. Similarly, rash is more common in dengue, but it can happen to a lesser extent in COVID-19. Retroorbital, the pain behind the eye, that is something which is typical to dengue, usually is not seen in COVID. In COVID, you have loss of smell, loss of taste, which usually doesn't happen in dengue. So there are these sort of similarities and differences. Coming to the second question, and I have
Just a small instruction. The students have another class at 1:15. So this might be our last question. Okay.
yeah. Just tell me the question. It slipped out of my mind. The second part of the question.
So can the one person be infected by dengue and COVID simultaneously?
Yes. So COVID and dengue infection can happen simultaneously. There have been few cases in India and also abroad where their co-infections have been seen. It is not very common, but it can happen simultaneously. And when it happens, it can actually complicate a lot of things. It can complicate the diagnosis. So you might miss out on some diagnosis. There can be false negative. You can have wrong diagnosis, which can be false positives. And you can also have the bleeding disorders, because both have bleeding tendencies, though because of different reasons. But that becomes the tricky part in terms of management, because management of bleeding in one is actually against the management of bleeding in the other. Okay, so that's where the problem comes in. I will not go into the whole medical details of it, but in simple language, yeah.
Pavni, over to you. Can you just conclude the session?
Yeah, just one question question, Pavni. They're repeatedly asking that if somebody has dengue in the fever, then the other person can get it in the family. So just to clear it with all of you, dengue does not spread from human to human directly by touch or living close to that person. But if somebody in your house has got dengue, that means there are Aedes mosquitoes around. So if there is any Aedes mosquito around, it can bite the infected person, suck the blood with the virus, and then infect other people in the house. So if you have anybody who has dengue infection, you should take more precautions so that other people do not get the infection. The dengue person can sleep under nets, usually during day. Remember, Aedes mosquito bites, especially during day, after the early morning, after sunrise and before sunset is the time when they mostly uh, bite. So you should, if there's any infected person, dengue confirmed case, just have mosquito coils around in the house, and if possible, the person can sleep under the bed net along with the other treatment the person should get. Okay, and only female mosquito spreads the infection, and the male mosquito cannot get it from female, and female mosquito cannot get the infection from the male. It doesn't go into the from mosquito to mosquito. It's only human to mosquito and mosquito to human. That is how the cycle goes. Okay, yeah. I'm just running through all the questions quickly. If there's something which we would have missed, I've not.
There is one interesting one. If you eat a lot of fruits and vegetables, will you get dengue? If you eat lots of fruit and vegetable, it is good for your body. It keeps you healthy. But unfortunately, it will not prevent you from, if a dengue infected mosquito bites you, it will not prevent you from getting dengue. It might lower the seriousness of the fever, but it will not prevent you from getting it.
Right. So just remember that you've asked so many questions about the mosquito, so many questions about dengue and treatment. But what is the easiest thing to do, and what, even if it is not easy, you should do is don't let mosquitoes breed in your homes, in your buildings, in your play areas, in your residential areas. Don't let any water collection happen. If there is any water collection, off. Ensure that all the garbage is thrown out properly. If there are any fountains in your society, if there are any ponds in your society, ask the adults to look into it. Either they will put some oil in it or Temiphos solution in it, or fishes. You can also put fishes, and then it will eat up the larvae. So focus on the control measures. Protect yourself. Children, we have said this repeatedly, children are more at risk of getting infection and more at risk of getting disease. So you are young adults, you are big enough to take care of yourself. Protect yourself, especially as I say, when the time you go to school and your playtime when you go outside. Try to wear full sleeves clothes. Try to apply Odomos or some other mosquito repellent in on your hands and feet, right? And don't apply it on face. Don't apply any mosquito repellent on face. And when even at home, because mosquito can breed under your bed, even at home during day, tell your parents to use mosquito coils during day also, because Anopheles mosquito for malaria will bite at night, but dengue mosquito, Aedes mosquito bites during day. So use mosquito coils during day also. Use nets or meshes on your doors and windows. So focus on these things also while you are talking about and getting worried about infection. If we get infection, what, right? The way you are thinking of corona, we should not get corona. If you get corona, then you have other things to for treatment and how we go about it. The first focus is do not let corona infection happen to you, right? Similarly, the first focus should be do not let dengue happen to you and your family. Okay, so share all this information with your neighbors, with your relatives. Teach your parents. I'm sure many of your parents would not know all this information. Teach everybody around you. I guess we have answered most of the questions now.
Yeah, and I think we should be closing this session
Yes.
as we have been informed that they have another class, so we
Okay,
should not be
great.
intruding. Yeah. So, Pavni, you want to conclude?
Yes, sir. Thank you, students, for a very interactive session. I hope you had learned about dengue and its symptoms and transmission. And if you have any queries, you can contact us also. So I would like to end this session. Thank you very much. Thank you, Ms. Poonam.
Thank you, ma'am. Thank you so much.
Thank you, everyone.
Thank you.